So we were talking about the absent right reflex. The causes could be congenital cataract, leukorrhea, or retinoblastoma. So we have to refer the patient to the pediatric ophthalmologist. And the commonest, if the congenital immediately after the birth, you have picked that. And if especially there are other problem like murmur, so you would have to exclude the rubella infection. Face rash with the conjunctivitis spread later to the trunk. Yes, conjunctivitis first initially starting from the upper and now to the trunk. Your diagnosis would be measles, not the rubella. Child with the rash started on the face, then spread to the trunk. Now without conjunctivitis. So behind the ear, on the face, on the neck, especially after getting infected, rash appears 2 to 3 weeks later, then your diagnosis would be rubella. Newborn child with the absent right reflex and the new murmur. What does this mother had when she was pregnant? Rubella infection. Congenital rubella, cataract, cardiac problem, deafness. A picture of the skin lesion, child, rash was red. Mother tell it start on the face and then go down to the trunk with the lymph node enlargement. And the lymph node enlarged in the groin area. Your diagnosis would be, yes. What would be your diagnosis? Rash started first on the face and then going down to the trunk with the lymphadenopathy. Your tie is between the rubella and the
Measles.
measles, yes. And since the measles
Ma'am,
is not in the option, then
rubella because ma'am there is lymphadenopathy.
hmm, this is the typical picture absence of the right eye reflex. We would refer to the pediatric ophthalmologist. That is the case of leukorrhea. We have to rule out the cataract and the retinoblastoma. Kawasaki disease, very interesting and very important topic. Let's just quickly revise this topic first and then we would solve the question. What is Kawasaki disease? It is a inflammatory inflammatory disease. ऑटोइम्यून है क्या है जी कावासाकी there would be generalized inflammation of the vessels. There would be vasculitis involving the medium to small blood vessels throughout the body. Throughout the body. What are the typical signs symptom of the Kawasaki? First is the redness or the rash over the body, enlarged lymph nodes in the neck, cracked red nipples, tongue would be red strawberry tongue. What else? Rash, red rash inside the mouth, inside the oral cavity. Baby could have the rash and the swollen hand and the feet, conjunctivitis. All the body would be red. Kawasaki disease. Kawasaki disease. Okay? Management. In the Kawasaki disease, we give the aspirin. क्या देते हैं हम aspirin as an anti-inflammatory, and that aspirin would be going with up to 6 to 8 weeks after the presentation of the symptoms. Okay, when would you go with the intravenous immunoglobulin? कावासाकी में हमने कहा है कि जी हम एस्प्रिन देते हैं, ठीक है. when would you give the gamma globulin or intravenous immunoglobulin?
Ma'am, to avoid the heart complications.
Okay, good. Because if there is a vasculitis, so obviously the vessels of the heart would be inflamed. So in order to avoid the complication, you would give the gamma globulin. Would it be first drug of the choice or first drug of the choice would be aspirin?
Ma'am, first drug of the choice will be aspirin,
Yes,
and then we will give
yes.
it.
And if the Kawasaki patient, you are suspecting some complication, like along with the inflammation, you see the baby is immunocompromised, there is thrombocytopenia, then for sure you would go with the immunoglobulin, IV immunoglobulin. Kawasaki sign, redness all over the body, face, trunk, body, feet, fever, strawberry tongue, conjunctivitis, cracked lips, fever. A case of Kawasaki disease, how will you assess the coronary artery disease? Through the echo. Through the echo. Kawasaki disease, assess for the heart complication, echocardiogram. Again, a child presents with the history of 5 days fever, oral mucosal lesion, cervical lymphadenopathy, lymphedema, and lab results essentially normal. What is the drug of the choice? Your diagnosis is Kawasaki disease. Your diagnosis is Kawasaki disease. How would you treat? Aspirin. Aspirin. And if they ask you in any of the scenario of Kawasaki disease, that what is the definitive treatment of the, or what is the most appropriate treatment of the Kawasaki disease, the most appropriate treatment of the Kawasaki disease would be IV immunoglobulin. It would give the two benefits. On the one hand, anti-inflammatory, on the other hand, prevents the complication. What is the best treatment of the Kawasaki? IV immunoglobulin and aspirin. Kawasaki best treatment, IV immunoglobulin. And if not in the option, go with the aspirin for sure. Child with the conjunctivitis, rash, lymph nodes, what to give? Again, a case of Kawasaki disease, you would give the aspirin. If the IV immunoglobulin in the option, go with immunoglobulin. What is the poor prognostic sign in the Kawasaki disease? Already patient given with the IV immunoglobulin. If CRP is high CRP is always showing that there is a massive inflammation inside the body. It would showing the poor prognosis. Poor prognosis, high CRP. A child complaining of the 5-day, again, Kawasaki disease, definitive treatment or the best would be IV immunoglobulin. If not mentioned, go with the aspirin. A case of Kawasaki asking about what will you reduce IV immunoglobulin. Okay, हमें पता है कि जी which will affect reduce IV immunoglobulin. That would be increased TLC count, neutrophilia, which indicated poor response to IV immunoglobulin. क्या indicate करेगा जी? Poor response. Poor prognostic factors सारे आएंगे. Neutrophilia, high CRP and hyponatremia. Kawasaki disease already on immunoglobulin. How to know if the bad prognosis? High CRP. Kawasaki case asking about which of the following is one of the criteria. Interior uveitis, myocarditis and injection conjunctivitis with no exudate. हाँ जी, हमें पता है कि यूवीआइटिस भी होता है कावासाकी में, मायोकार्डाइटिस भी होता है और आर्थराइटिस भी. Generalized vasculitis inflammation है. So that would not be the part of Kawasaki criteria. That there would be inflammation at the site of injection or no exudate. Again, the same question, high ESR, CRP with all the signs, symptom of the Kawasaki disease. Same question. Again, the same question. Confirmation of the Kawasaki clinical diagnosis. A child with the vesicle at the lip, gum and proximal tongue and hard palate. Yes, vesicle है. क्या है? ये तो typical हम देखते हैं. Gingivostomatitis. Gingivostomatitis viral infections में common होता है और management would be symptomatic management. Pediatric patient with the egg allergy contraindication. Every baby, every person having egg protein allergy or sensitivity, you would not give the yellow fever. There would be anaphylactic reaction. So you would not give the yellow fever vaccination. 4-year-old child, fully vaccinated child, came to ER with a 1-day history of the fever, sore throat, started on the same day. What is your diagnosis? Okay, how would you pick the scarlet fever? What is scarlet fever? इसमें भी रैश होती है, रेडनेस आती है. What is scarlet fever? Again, infection which is caused by streptococcal species, group A. It is commonly affecting the children between the age of 5 to 15 years of the age. Number one. Sign, sore throat, fever, headache, lymphadenopathy, and a rash. Yes. What type of the rash? स्कारलेट फीवर की रैश कैसी होती है शाबाश?
मैम सैंडपेपर लाइक रैश होती है
Yes,
उसको।
excellent. Sandpaper like rash, bumpy rash, rough rash. Okay, it would spread all over the body. Very good. Patient with the pharyngitis for 2 days. What is the possible complication? Possible complication with the pharyngitis, tonsillitis, and the scarlet fever. And even tonsillitis and the pharyngitis, these two already are the risk factor for the scarlet fever. Scarlet fever. Okay, can somebody tell me how would you diagnose scarlet fever? क्लिनिकल होगा कि टेस्ट कराएंगे? Clinical, on the basis of the history and your examination finding, your sandpaper like rash. Okay, and sample, you would take the throat swab and it would be sent for the culture and the sensitivity. Peritonsillar abscess, जिसको हम क्विंजी भी कहते हैं, we used to study in the ENT. We used to study in the ENT. क्या होता है जी क्विंजी? शाबाश. क्विंसी या प्रीटॉन्सिलर एब्सेस पढ़ता करते थे, क्या होती थी? पस है, नेम इंडिकेट कर रहा है पेरिटॉन्सिलर एब्सेस. देयर वुड बी कलेक्शन ऑफ द पस ऑन द पेरिटॉन्सिलर पिलर्स, पेरिटॉन्सिलर स्पेस बिटवीन द tonsillar capsule and the superior constrictor muscle. There would be a pocket of the pus. What is the presentation? What are the symptoms of the quinsy or peritonsillar abscess? Pain in the throat. Number one, sore throat, fever, difficulty in the swallowing, change in the voice. Complication, immune mediated complication. Scarlet fever भी immune mediated है, acute rheumatic fever, post streptococcal glomerulonephritis or reactive arthritis. These are all the immune mediated complications. Acute onset of the fever, sore throat, strawberry tongue. Yes, क्या है ये? Acute onset for the fever. Would it be scarlet now? Yes, because in case of Kawasaki, the history of the fever would be more than 5 days. There would be redness all over the body. So it would be acute onset of the rash, scarlet fever. 24 to 48 hours after the pharyngitis. If the rash begins in the groin area, axilla, neck, antecubital fossa, and the pistia lines, may be attenuated with the flexor area. Within 24 hours, sand rash becomes generalized with the perioral sparring and non-pruritic, non-painful, blanchable rash. That is scarlet fever. ये explain कर रहा है scarlet fever का. Your treatment of the choice would be penicillin or the amoxicillin. A 12-year-old girl presented to her pediatrician for a sore throat. Her symptom began approximately 1 week ago. After she attended a sleepover, since then she experienced a sore throat, noted a temperature high grade 101. She denies a cough. She noticed increased fatigue, difficulty swallowing. On examination, she has anterior cervical lymphadenopathy, patches, tonsillar exudate or abscess, swelling. What would be the most common complication? Yes. Post-pharyngitis tonsillitis, the commonest complication would be scarlet fever. Scarlet fever. Yes. Diagnostic of the pharyngitis, maybe there could be streptococcal species, especially A, group A. this you could see. What is this rash? हाँ जी, स्कारलेट फीवर रैश, स्टैंड लाइक, उभरी भी होगी, पैची होगी, रफ बम्पी होगी, that would be scarlet fever rash. Patient with the fever, cervical lymphadenopathy, and the patchable rash, patchy rash. Complication would be complication of the pharyngitis or the tonsillitis. Your diagnosis would be scarlet fever. Again, explanation. It is a disease that occurs as a complication of the group A streptococcal infection. The signs symptoms include the throat, pain in the throat, fever, headache, low swollen lymph node, and the characteristic rash. Pediatric patient with the fever, on examination, there is a white membrane covering the tonsil. The most likely complication to be happened is post-pharyngitis, post-tonsillitis, scarlet fever. Complication of tonsillitis, scarlet fever. 14-year-old had fever, pharyngeal exudate, lymphadenopathy, most common complication. Post-pharyngitis, scarlet fever. A case of the infant have the cough and the low-grade fever, rash and the runny nose. What is your diagnosis? Yes, cough bhi hai, low-grade fever bhi and the rash. This is again a case of measles. Measles. हाँ जी, measles का पैथोजन क्या होता है? measles का पैथोजन क्या होता है?
Herpes simplex virus.
कौन सा सॉरी?
Herpes. Herpes.
हाँ हाँ, हर्पीस नहीं होता. यस. कौन सा वायरस होता है जी? यार वेरिसोला जोस्टर, वेरिसोला जोस्टर वायरस का बताया था. या फिर आप हर्पीस में वेरिसोला जोस्टर कहना चाह रहे थे? आई थॉट सिंप्लेक्स कह रहे थे.
मैम मैं सिंप्लेक्स ही कह रहा था, दोस्त नहीं कह
अच्छा,
रहा था.
बट
इनमें मैं कंफ्यूज हो गया.
हर्पीस की फैमिलीज में से वेरिसोला जोस्टर होता है. ठीक है. A child with the fever, vomiting, rash on the second day, then rash. अच्छा जी, fever, vomiting है, second day rash, then it become all over the body. Rocky Mountain fever. अच्छा जी, Rocky Mountain fever इसने कैसे डायग्नोस कर लिया? कैसे प्रेजेंट करता है रॉकी माउंटेन फीवर? रॉकी माउंटेन स्पॉटेड फीवर होता है ना, कैसे करता है? रॉकी माउंटेन स्पॉटेड फीवर इज ड्यू टू बैक्टीरिया. बैक्टीरिया कौन सा बैक्टीरिया होता है? कौन सा बैक्टीरिया होता है? शाबाश. विच इज स्प्रेड बाय द टिक बाइट. टिक बाइट से होता है ना. कौन सा बैक्टीरिया होता है? शाबाश. रिकेट्सियल. रिकेट्सियल कहते थे ना हम, रिकेट्स आए. इसको दूसरा नेम रॉकी माउंटेन स्पॉटेड फीवर का नाम भी यही है, रिकेट्सियोसिस. सो रिकेट्सिया बैक्टीरिया होता है. यस. व्हाट इज द प्रेजेंटेशन? और ये टिक्स इसीलिए नाम लिया है कि इसकी टिक की बाइट से ये स्प्रेड करता है. यस. व्हाट इज द प्रेजेंटेशन ऑफ द सिम्टम्स? शाबाश. रैश, फीवर, हेडेक. Fever would be associated with the chills and rigor, severe pain in the throat, sore throat. Patient would be having confusion, letharginess, abdominal pain, nausea, vomiting, diarrhea, and photophobia. And photophobia. That is the classical presentation of the Rocky Mountain fever. अच्छा जी, रैश कैसी होती है इसकी? टिपिकल रैश कैसी होती है? Which is a sign of the Rocky Mountain spotted fever. रैश होती है, it usually develop 2 to 4 days after the fever begins. पहले सिम्टम आएगा फीवर का, then after the fever 2 to 4 days the rash would appear. कहाँ कहाँ रैश आती है? टिपिकल अपीयरेंस कैसी होती है रैश की? जो जिस तरह मैं आपको इमेज शेयर कर रही हूँ उसका रैश, स्पॉट्स होते हैं, स्पॉट्स रैश के. Okay जी, next question is prophylaxis for the contact with the pertussis. अच्छा जी, bordetella pertussis के लिए prophylaxis क्या है? मैक्रोलाइड एंटीबायोटिक्स, मैक्रोलाइड्स में भी हमारे पास जिथ्रोमाइसिन, रिथ्रोमाइसिन एंड क्लेरिथ्रोमाइसिन आता है, ठीक है। वुपिंग कफ के लिए कह रहे हैं हम। वुपिंग कफ भी हमने पढ़ा था। पर्टूसिस क्या होता है, कैसे प्रेजेंट करता है वुपिंग कफ? बॉडीटेला पर्टूसिस कहते हैं ना वुपिंग कफ, कैसे प्रेजेंट करता है? इट इज अ कंटेजियस, नंबर वन। इनिशियली देयर वुड बी कंजेशन वाले सारे सिम्टम, रनी नोज, फीवर, सोर थ्रोट, कफिंग। Pediatric patient not vaccinated presented with the sore throat, cervical lymphadenopathy. What is your diagnosis? Okay, अगर तो generalized lymphadenopathy आ रही है massive, ठीक है, पूरा neck भरा हुआ है, then your diagnosis would be diphtheria. Diphtheria. अब उन्होंने क्यों कहा है कि baby is not vaccinated? Yes, डिप्थीरिया की हम वैसे भी बच्चों में देते हैं, डीपीटी की वैक्सीन दे रहे होते हैं, ठीक है। सो दैट्स वाई वो आपको क्लू दे रहा है कि डिप्थीरिया वैसे कैसे प्रेजेंट करता है, फीवर भी होगा, सॉर थ्रोट भी होगा, देयर वुड बी अ ग्रेइश मेम्ब्रेन ओवर द टॉन्सिल्स इन डिप्थीरिया। हाउ मेनी इयर्स द पर्टूसिस वैक्सीन लास्ट? 10 इयर्स तक, फिर इसका बूस्टर लगता है। 1 year old never vaccinated presented with the hacking cough and inspiratory stridor, bordetella pertussis, whooping cough. Pertussis with the severe vomiting, most commonest complication, pneumonia. I guess this is enough for today. And inshallah, tomorrow we would discuss the rest of the infection in the peds. अभी कोई क्वेश्चन होगा so do share on the WhatsApp. Inshallah, we would answer, and I would share the recording today. Inshallah, yesterday there was a problem with the storage. That's why thanks to Dr. Yasir who recorded the lecture and shared with you people. And tomorrow after the conversion, I would share my recordings. Any question? Okay, ji. Thank you so much. Have a good day. Take care. Allah Hafiz.